Signs you have a potassium deficiency. A potassium deficiency can occur when the body loses more potassium than it takes in, or when it's unable to absorb enough of this mineral from the digestive tract. As a result, potassium levels become too low, which can lead to muscle weakness, fatigue, and other health problems. Potassium is a mineral that plays a role in the electrical activity of your heart, helping it to contract and relax. It also helps regulate the amount of fluid in your body, so it's important to get enough potassium in your diet. Having a potassium deficiency is most commonly caused by kidney disease or type 1 diabetes, which are both associated with high blood pressure. However, an insufficient intake of this nutrient can also cause a deficiency if you don't eat enough fruits and vegetables. In severe cases, it can cause cardiac arrest, but this is rare. In this video, we will discuss the signs of potassium deficiency. Please note that everything mentioned in this video is unbiased, fact-checked, and reviewed by qualified health professionals. Muscle weakness and cramps. The most common symptom of low potassium is muscle weakness. If your muscles are weak and crampy, it may be because your body doesn't have enough potassium to keep them functioning properly. Inadequate intake of magnesium can also contribute to muscle weakness, but it's less common than low potassium levels. Certain individuals, such as those taking diuretics or laxatives, people with high levels of aldosterone, those consuming excessive amounts of salt, and women with heavy menstrual periods due to pregnancy or birth control pills, are at greater risk of developing a potassium deficiency. Weakness and fatigue. Potassium deficiency may result from the excessive loss of body fluids, such as during prolonged diarrhea, vomiting, or sweating. Symptoms of potassium deficiency include excessive fatigue, feeling lightheaded after standing up quickly, or weakness during physical activity. If you experience persistent tiredness and lethargy, it's important to consult a healthcare professional to determine the underlying cause. Digestive problems. Potassium deficiency can cause digestive problems such as gastritis or inflammation of the stomach lining. This may be accompanied by symptoms like nausea, vomiting, and abdominal pain. Insufficient potassium affects the muscles of the intestines and colon, including those responsible for pushing food through the digestive tract. Potassium helps regulate the movement of food by stimulating the release of digestive juices from the stomach, pancreas, and bile from the gallbladder. Inadequate potassium intake can result in insufficient production of digestive enzymes and improper digestion. Constipation. Low potassium levels in the blood can contribute to constipation. Potassium is necessary for regulating muscle contractions in the gastrointestinal tract. When there's a potassium deficiency, it can affect the digestion of food and the absorption of water by the intestines, leading to constipation. Abnormal heartbeat. Potassium deficiency can cause abnormal heart rhythms due to disruptions in the normal electrical activity of the heart. Research has shown that low potassium levels are associated with an increased heart rate, while high potassium levels are associated with a decreased heart rate. If you experience an irregular heartbeat, it's essential to seek medical advice rather than self-diagnosing or self-treating. Bone loss and numbness. Potassium deficiency is more common among people who consume a high-protein diet. Insufficient potassium in the diet may lead to the body extracting potassium from bones, resulting in bone loss and an increased risk of fractures. Numbness in the arms and legs can also occur due to nerve damage caused by low potassium levels. Breathing difficulties. Potassium deficiency may cause breathing difficulties, especially in individuals with kidney disease or an eating disorder that causes potassium loss. Potassium is essential for muscle contraction, including the muscles of the heart, lungs, and digestive tract. A lack of potassium can lead to a condition called hyperkalemia, which increases blood acidity and impairs the body's ability to pump blood effectively. This can result in breathing difficulties. High blood pressure. Potassium plays a crucial role in maintaining healthy blood pressure. A deficiency in potassium can increase the risk of developing high blood pressure. When potassium levels are low, the kidneys respond by retaining more sodium and water, leading to increased blood volume and elevated blood pressure. Polyuria. Potassium deficiency can cause polyuria, which refers to excessive urination. This occurs due to increased sodium absorption by the kidneys. Potassium helps regulate water balance in the body and acts as a counterbalance to sodium. When potassium levels are insufficient, excess fluid may be lost through urine, potentially leading to dehydration. Treating a potassium deficiency. If you suspect a potassium deficiency, it is essential to consult with your doctor before considering any supplements. Potassium deficiency is a serious condition that should be addressed under medical guidance to avoid potential side effects. There are several ways to treat potassium deficiency. Increase dietary intake. Consuming foods rich in potassium can help replenish your potassium levels. Examples include bananas, spinach, avocados, beans, fish, potatoes, tomatoes, and broccoli. Milk is also a good source of potassium, with approximately 300 milligrams per serving. Salt substitutes. Sodium substitutes containing potassium chloride instead of sodium chloride can be used in place of regular salt. However, it's crucial to consult with your doctor before using salt substitutes if you have high blood pressure or heart disease. Stay hydrated. Dehydration can contribute to low potassium levels. Drinking enough water helps your body eliminate excess sodium and promotes potassium balance. It's important to note that the body can store potassium for up to 24 hours. Therefore, a potassium deficiency does not develop overnight. It may take several days, or even weeks, before symptoms of low potassium levels appear. If you experience symptoms such as fatigue, weakness, muscle weakness, vomiting, or changes in reflexes, it's advisable to check your potassium levels with a healthcare professional. Preventing potassium deficiency is relatively straightforward. By including potassium-rich foods in your diet, such as those mentioned earlier, you can maintain adequate potassium levels. Additionally, following any prescribed supplements from your doctor can help ensure your potassium levels remain normal. Taking care of your body's potassium levels is vital for your overall well-being. By addressing any deficiencies promptly, you can support healthy muscle function, maintain proper heart rhythm, regulate blood pressure, and prevent complications associated with low potassium levels. Now, please share your thoughts and questions in the comment section of this video, as we would love to hear your experiences on this subject. We do read every comment, and we thank you for your participation. If you found this information helpful, please like this video and subscribe to our channel for more informative content.